Reducing the duration or intensity of menstruation can be desirable for many individuals, whether to manage heavy bleeding, pain, or simply for convenience. While there's no one-size-fits-all solution, here are 5 common approaches to help reduce menstruation. 1. Hormonal birth control. How it helps. Birth control methods, especially those containing synthetic hormones, like oral contraceptives, IUDs, or the contraceptive injection, can help regulate or even shorten menstrual cycles. Some types of birth control, such as the progestin-only IUD, Mirena, can significantly reduce the number of periods a person has, and sometimes stop them altogether. Why it works. Hormonal birth control regulates the menstrual cycle and often results in lighter or shorter periods. For some individuals, it can reduce bleeding to the point of not menstruating at all. 2. Progesterone therapy. How it helps. Taking progesterone, either orally via injection or in the form of an IUD, can help decrease the flow and duration of menstruation. Why it works. Progesterone helps balance estrogen levels, leading to lighter, shorter periods. It also helps prevent overgrowth of the uterine lining, which is a common cause of heavy periods. 3. Non-steroidal anti-inflammatory drugs, NSAIDs. How it helps. Medications like ibuprofen or naproxen, Advil, Motrin, Aleve, can reduce menstrual bleeding by inhibiting the production of prostaglandins, chemicals in the body that cause uterine contractions and heavy bleeding. Why it works. By reducing prostaglandin levels, NSAIDs can reduce pain, cramping, and heavy bleeding. While this doesn't necessarily shorten the duration of the period, it can reduce its intensity. 4. Endometrial ablation. How it helps. This medical procedure involves removing or destroying the uterine lining, endometrium, to reduce or eliminate menstrual bleeding. Why it works. With less or no uterine lining, there's less blood flow, resulting in shorter or absent periods. It's often recommended for those with excessively heavy bleeding or conditions like endometriosis or fibroids. 5. Dietary changes and supplements. How it helps. Certain dietary adjustments and supplements can influence menstrual flow and help reduce it. For example, vitamin B6, magnesium, and omega-3 fatty acids may help regulate hormones and reduce inflammation. Why it works. A balanced diet with anti-inflammatory foods, including fatty fish, leafy greens, and whole grains, may help manage period symptoms. Certain herbs, like raspberry leaf and ginger, have been traditionally used to reduce menstrual flow and cramps. Important notes. Consult a healthcare provider before starting any new treatment, especially when considering hormonal methods or medical procedures like endometrial ablation. These options work differently for different people depending on their specific health needs, age, and reproductive goals.